Hello, my name is Borshika Rabin. I would like to welcome you on behalf of our UC San Diego ACTRI Dissemination and Implementation Science Center. In this video, Dr. Nicole Stednick and I will provide you with a brief introduction to dissemination and implementation science. We will discuss key terms and concepts and guide you to additional resources to learn more. Those who decide to pursue health research or practice as their profession will closely relate to the following quote. The long-term goal of any health-related endeavor should ultimately be to improve the human condition through decreasing disease risk and prevalence and increasing the quality of life. However, we too often fall short of this goal. Based on an often quoted study from Balash and colleagues from 2000, we know that it takes on an average 17 years to get 14% of health research into routine clinical care or public health practice. A more recent study by Khan and colleagues on cancer prevention and control interventions found very similar timeframes between the initial publication about a prevention or control measure and its implementation into routine practice, showing a range of 13 to 21 years across diverse areas such as mammograms, colorectal cancer screening, or advising for smoking cessation. The ultimate goal of dissemination and implementation science is to address this evidence practice gap and facilitate the more rapid and complete dissemination and implementation of evidence-based programs into routine care across diverse settings, populations, and topics. As such, dissemination research is defined as the scientific study of the targeted distribution of information and intervention materials to a specific public health or clinical practice audience. And implementation research is conceptualized as the scientific study of the use of strategies to adopt and integrate evidence-based health interventions into clinical and community settings to improve individual outcomes and benefit population health. If you look at the broader picture of public health and health services research, dissemination and implementation science is often placed under the umbrella of population health and health services research, showing overlap with quality improvement science and a connection with quality improvement practice. While arguably there are multiple ways we could position these ovals, we all agree that these various types of research approaches are closely connected and do not represent mutually exclusive research questions, methods, or designs. When looking at the National Institutes of Health T1 to T4 translation continuum, most frequently dissemination and implementation research is placed at the T3 and T4 phases. However, we like to argue that there are many meaningful ways in which D&I science can inform earlier phase research and have impact in the T1, T2 phases. In fact, Lapin and colleagues in their paper in the Journal of Clinical and Translational Science provide a really nice overview of how dissemination and implementation science can be considered and integrated at each phase of the translational continuum. When contrasting research questions from efficacy, effectiveness, and D&I research, we can think of these using the following generic questions. For efficacy research, does this intervention or program work under optimal conditions? For effectiveness research, does this intervention work under real-world conditions? And finally, for dissemination and implementation research, when, where, how, with whom, under what circumstances, and why does this intervention work? It is also important to remember to place D&I research into the context where it is used. Most, if not all, work done in D&I science is conceptualized in multi-level complex contexts, often requiring interventions at multiple levels. These complex structure, of course, will have an impact on what type of models, methods, and measures can be used successfully in D&I science. If we wanted to summarize the key characteristics of D&I science, we could use the following constructs. D&I science is highly contextual acknowledges multi-level complexities, and often focuses on systems characteristics. It endorses robust practical goals such as representativeness and reach, especially as it relates to addressing health equity, generalizability, practical and pragmatic designs, and scalability and sustainability. While D&I research maintains rigor in its designs, it also acknowledges the need for rapid and adaptive approaches and the need for integration of multiple data types, perspectives, and the critical importance of real-world relevance. Finally, D&I research maintains flexibility through endorsing multiple solutions and, my favorite, respect for diverse approaches and humility as we work with diverse populations. A summary of key ingredients of dissemination and implementation research is provided on this slide. These include the evidence-based intervention, the dissemination and implementation strategy, the dissemination and implementation theory, model, or framework, and then the related designs, outcomes, and measures. At the center of the visual is stakeholder engagement, which ideally informs all of these ingredients. The next set of slides will briefly discuss each of these ingredients. When defining evidence-based interventions, we often use a broad definition. Using the 7 Ps can help us remember this. The 7 Ps suggest that evidence-based interventions can include programs, practices, principles, procedures, products, pills, and policies. As you define your evidence-based intervention, you can use this broad definition. If evidence-based interventions are the what is being disseminated and implemented, dissemination and implementation strategies are the how. A few different definitions of D&I strategies are provided on this slide. The general concept is that D&I strategies are methods, processes, or techniques that support the uptake, ongoing implementation, and sustained use of EPIS. Powell and colleagues developed a broadly used taxonomy of implementation strategies, often referred to as the ERIC strategies. The ERIC strategies provide an expert consensus on a common nomenclature for implementation strategy terms, definitions, and categories that can be used to guide implementation research and practice. They distinguish between discrete and multifaceted implementation strategies. Discrete strategies include single actions or processes, including reminders or audit and feedback or supervision. Multifaceted implementation strategies include a combination of multiple discrete strategies. They can be a combination of educational workshops and consultation, or some protocolized branded implementation strategies such as the LOCI developed by Dr. Greg Ahrens, who is part of our center. The third key ingredient of D&I science is dissemination and implementation theories, models, and frameworks. These can provide systematic structure for the development, management, and evaluation of interventions and D&I efforts. They can also ensure that we include the essential D&I strategies for success. They enhance the interpretability of study findings. They guide what is important to measure. They provide explanation of why an intervention worked or did not work. And finally, they are a critical ingredient for successful D&I grant proposal. There is a wealth of existing D&I theories, models, and frameworks to choose from. A recent review identified as many as 159 D&I relevant theories, models, and frameworks. So selecting a D&I model might feel daunting. One helpful approach is to simplify the selection by using a logic model. Logic models are well known and commonly applied in public health practice. They can be an excellent starting point for the development of your D&I proposal as well. On this slide, you can see a dissemination and implementation research-focused logic model, which was developed by J.D. Smith and colleagues. which distinguishes determinants, implementation strategies, and the clinical intervention, mechanisms, and various types of outcomes, including implementation, service, and clinical or patient outcomes. The next slide shows how colleagues at the UC San Diego Center for AIDS Research adopted this logic model and created a logic model for their HIV-focused implementation science project. Let me point out that this was not their first draft of the logic model, but after multiple iterations and with input from various stakeholders, they were able to create a logic model that incorporates many aspects of D&I science while maintaining a logic model format that often resonates well with community partners. Next, Dr. Stednick will provide you with an overview of D&I science theories, models, and frameworks, and provide you with additional guidance on selection of theories, models, and frameworks. Thank you.
Hello, my name is Nicole Stadnick, and I'm the Director of Dissemination and Evaluation at the UC San Diego ACTRI D&I Science Center. In the last half of this presentation, I'll walk you through the following topics: D&I theory, models, and frameworks, pragmatic measures, study design considerations, and key resources to continue your D&I journey. I start with an acknowledgement that there are numerous D&I theories, models, and frameworks. Borshika shared with you some examples previously. Theories are like toothbrushes. Everyone has one, and no one wants to use anyone else's. We hope that this orientation will encourage you to think about some of the existing theories, models, and frameworks that may work best for your work and setting. This is a helpful visual that provides an overview of the primary functions of theories, models, and frameworks. So there are three primary functions. The first is to describe and or guide the process of translating research into practice, and these are process models. The second function is to understand and or explain what influences implementation outcomes. And these can include determinant frameworks, classic theories, and implementation theories. The third function is to evaluate implementation efforts, and these can be evaluation frameworks. A theory, model, or framework that I'll show you a couple in the next few slides, they can be more than one of these different functions. To help you think about and select an appropriate theory, model, or framework, or theories, models, or frameworks, more than one theory, model, or framework may be needed to appropriately answer the questions or goals of your project. These are some helpful considerations. What's the purpose of the framework? What level or levels does the framework address? What implementation concepts are included? How generalizable or specific is the framework's orientation? For example, is it specific to a specific service setting, or is it specific to a particular intervention? Are there measures available to assess the implementation concepts or outcomes in the framework? And then what is the time frame, either for the implementation effort or for your particular project? Our colleagues and myself developed a publication that provides 10 recommendations for using implementation frameworks in research and practice. And so the 10 recommendations, we list them in order of relative chronological order and how you might approach an implementation project. So the first is selecting an appropriate implementation framework or frameworks. And at the end, the recommendation about how to apply implementation framework is writing a proposal and reporting it in some way. To guide thinking about each of these recommendations, we developed 2 worksheets. This first worksheet helps you think about operationalizing each of these recommendations to your project. So we include some questions that might help you answer, are you adhering to or thinking about these recommendations relevant to your project? The second worksheet is helpful in as you are executing the project and may want to evaluate if any parts of the project need to be changed, if any parts of the implementation framework need to be reassessed or reevaluated. And so this framework utilization tool can be used as a check and assessment of any adaptations that may be needed. A few examples of some very well-known implementation science frameworks that may be of interest or relevant to your project include the Exploration, Preparation, Implementation, and Sustainment framework. This is a framework that is often well known for its delineated phases that are both progressive and recursive in nature and articulate really important contextual levels and factors that relate to both the evidence-based practice itself and the interconnectedness between the outer and inner contexts that might influence implementation. Another important and well-known framework includes the Reach Effectiveness Adoption, Implementation, and Maintenance Framework, REAIM, which has also been expanded to include the Practical, Robust Implementation and Sustainability Model. At the heart of REAIM is in the middle of this slide here, and it has a focus on implementation outcomes. So the Reach Effectiveness Adoption, Implementation, and Maintenance of the evidence-based intervention and its components and the implementation strategies. PRISM, shown here on this slide, expanded that focus on implementation outcomes to really consider the context in which implementation occurs. Another relatively new framework that we wanted to highlight is the Health Equity Implementation Framework. In this, very similar to REAIM, PRISM, and EPIS, has a focus on multi-level influences that affect implementation, but it explicitly has a focus on understanding the determinants that might affect health equity and resulting improvements in health equity. Finally, we wanted to share this really seminal framework, the Implementation Outcomes Framework developed by Proctor and colleagues. And so in this framework, the understanding is that typically what has been done is there's an evidence-based practice, one of the 7 Ps, a policy, practice, product, pill, etc., that is implemented. And it's hypothesized or shown to affect patient outcomes, clinical health status, symptoms, function, or satisfaction. The Implementation Outcomes Framework goes further and delineates implementation outcomes, which are the results of explicit and thoughtful implementation strategies like facilitation, audit and feedback, and training. And implementation outcomes, they have deliberate and propositive actions to implement new treatments, practices, and services. They have 3 important functions. They serve as indicators of implementation success. They are proximal indicators of implementation processes, and they're key intermediate outcomes in relation to service systems and clinical outcomes and treatment effectiveness research. So here, putting this all together, this framework is very, very helpful in thinking through the what you're implementing, the how you're implementing it with your implementation strategies, and then the resulting outcomes that are first triggered by implementation outcomes and trickle down to service outcomes and patient outcomes. And this is really the core of implementation science. We wanted to also acknowledge the key role of community engagement that can affect the what, how, and the outcomes, the implementation, service, and patient outcomes. And so this slide really reflects that community engagement has a role in all parts of implementation, in the what is selected, and the how it's implemented, and the evaluation of outcomes. This is a really helpful website, the Dissemination and Implementation Models tool website, and it helps you navigate and select different D&I models. So we encourage you to take a look at this and consider it as you're planning or executing an implementation project. Next, I want to move us into pragmatic measures and overall D&I measurement. This slide here shows you a contrast between gold standard measure rating criteria and practical or pragmatic measure rating criteria. And the pragmatic measure rating criteria is really what we're trying to move into in implementation science methods, with the acknowledgement that implementation needs to be responsive, timely, and rigorous. And so I'll focus just on the categories for the pragmatic measure rating criteria. A pragmatic measure needs to include the following key considerations. It needs to be feasible, so brief, generally 2 to 5 items or less if possible, easy to administer, score, and interpret. It needs to be important to practitioners and stakeholders, and these can include organizational leaders, policymakers, and patients. It needs to be actionable. So based on the information that's provided by the measure, there needs to be realistic action that can be taken. It also needs to ideally be user-friendly, so it can be very easily interpreted by patients and other stakeholders. It has space validity, and it's meaningful, again, to different stakeholders, clinicians, public health officials, and policymakers. It also needs to be low cost. So ideally, it's publicly available, free, or very low cost to use, administer, score, and interpret. A pragmatic measure ideally also needs to enhance patient engagement. So having the information from the measure is likely to further patient engagement in care or in the evidence-based practice of focus. And then finally, a pragmatic measure should do no harm. So it can likely be collected without interfering with relationships, putting respondents at risk, or creating unintended negative consequences. And so we have a few slides about resources about where you can find pragmatic measures. So this is a seminal article that includes measurement resources for D&I research. It's a few years old, but it includes a total of 17 resources, including some web-based repositories and static reviews or tools that can be helpful as you're thinking about and selecting pragmatic measures. A few other sources that we wanted to highlight. The first is the Society for Implementation Research Collaboration Instrument Review Project. So on this website, arranged by the Consolidated Framework for Implementation Research, another framework that we didn't spend too much time on in this presentation, but is another important framework for you to consider. The website here organizes implementation outcomes and associated pragmatic measures by the CFR framework. The second here is the GEM National Cancer Institute website, also has a guide to pragmatic measures. And finally, PROMISE, which is an NIH initiative, it has a number of more patient-facing, patient-focused pragmatic measures to consider. So we wanted to share with you some bigger picture study design considerations for your D&I research. As you've probably seen through the theories, models, and frameworks that we've talked about and pragmatic measure consideration, implementation research is multi-level. Implementation of policy, practice, pill, product, et cetera, it influences an individual person, patient, clinician, their relationship with different care providers, systems. There's an organizational architecture that provides guidance or decision-making about how things can get implemented. And there's a community around the organizations and individuals who are seeking services, who are engaging in different healthcare decisions. And then finally, there's also a policy context that drives a lot of the decisions and opportunities for implementation. Another study design consideration is that implementation research is systems-oriented. So there can be interaction and likely interaction between multiple of these components. For your individual study design, group level assignment may be at different levels. So the organizational level or the provider level, rather than at the more traditional patient level. And then finally, implementation research is almost always dynamic. Implementation is not a single action, it's a process within and across stages, and those processes can be measured. So in summary, we wanted to wrap this up with some simple language offered by our colleague Jeff Curran. So the thing is the intervention, innovation, or practice. Effectiveness research looks at whether the thing works. Implementation research looks at how best to help people and places do the thing. Implementation strategies, they are the stuff we do to try to help people and places do the thing. And then finally, implementation outcomes are how much and how well they do the thing. We'll conclude with a few resources online that may be helpful as you continue your D&I journey. The first here is the National Cancer Institute, Division of Cancer Control and Population Sciences. They have a dedicated implementation science component on their website, and it includes webinars, a blog, sample D&I grants that have been successfully funded, and other research tools. Our own DISC website also includes a number of resources. And if I go to this next slide, you'll see we have a couple of one-page DISC documents. One is a D&I basics document. One is a document about trainings that are available that may be of interest to you. We provide QR codes to each of these, but you're also welcome to take a self-guided tour of the website. For questions or comments, we have our contact information up here. We're available through email, the web. We encourage you to become a DISC member or investigator if you haven't already. And you can follow us on Twitter at IMSCI-UCSD. With that, we thank you for your time, and we look forward to learning about and learning from your D&I research and practice. Thank you.